Welcome to Part 2.5 of this lecture series on referrals. Here we will review how to conduct a referral. We have discussed in a previous class the various different types of mental health providers. It is important to be able to distinguish between these mental health providers to determine whom would be a good fit for the individual you may refer. This is not an exhaustive list of all healthcare providers, but most commonly you would refer an individual to a psychologist, psychiatrist, social worker, licensed counselor or therapist, or a sports psychologist. Here at Westchester University, if you visit our counseling center on campus, you will meet with a licensed psychologist, although we do have a resident on-call psychiatrist as well. As a reminder, there currently is no regulation on who can call themselves a sports psychologist. As long as you're a licensed psychologist, you can hang up a shingle and call yourself a sports psychologist. Therefore, it's important to know exactly who you're referring an individual, or in particular an athlete, to, and find out their background and experience. As we have explored various different skills one may need to conduct an interview or provide a referral, there are also very important characteristics that ideally you would have in the shared relationship between you and the individual you may refer. These characteristics include honesty and candor, open, accepting, and receptive, affirming and encouraging, and committal and action-oriented. You should encompass honesty and candor in your relationship with the individual you are going to refer. This includes keeping lines of communication clean and clear of misconception or deceit. You should be honest in your approach with this individual. You should also be open, accepting, and receptive. Don't respond with your own evaluations to what the individual has disclosed to you. Even if their disclosure is contrary to your belief or what you would do, you should be open and accepting. If you're not, this could compromise the trust of the individual with you. You should also demonstrate genuine interest and concern. Consider that if they came to you for help, it's because they trust you and they believe that you care about them. You should be able to demonstrate this to them. When referring an individual, you should be affirming and encouraging. Keep in mind that some or many psychosocial issues may be very painful, even to just talk about. Recognize that it takes a lot of strength to come to someone with a psychosocial issue. Reassure and encourage the individual of this verbally. Tell them how strong you think they are that they're able to come to you and talk to you about this. You should also be committal and action-oriented. You should stay with them throughout the process. Don't prod into their counseling if you're able to get them to see a therapist, but reassure the individual that you're still there for them. If you gave a commitment to this individual's issue, live up to it. Check in and follow up with them, just to see that they're okay. Consider your role in this process. You're a resource, a consultant, and a medium between the individual and their health and well-being. If you're an athletic trainer, keep in mind that you're equipped with special knowledge of the athlete. You can provide unique resources in which you usually will know the athlete before they're struggling, while they're struggling, and hopefully after they're recovering. You can assist in resolving issues that the athlete may not be able to resolve on their own, and in particular, providing a psychosocial referral. A referral is not as simple as sitting down and making an appointment, as we previously discussed. There are various steps to providing an appropriate referral. If you are an athletic trainer or healthcare provider, you should have a list on hand of mental health professionals to refer to, including specialists who cover a variety of issues, such as eating disorders, depression, substance abuse, etc. The next step is assessment. In this step, you'll identify the who, what, where, why, and how. This is gaining information through the interview process that you previously learned about. The pre-action step includes advanced contact with a mental health professional. Find out whom you may refer this individual to, what's their background and their experience. You should also rehearse the planned conversation as best you can for the referral. This will help reduce your own anxiety in the interview process or the confrontation or caring confrontation with that individual. The next step is action. This is the step in which you'll actually introduce the referral to the patient. You'll offer more than one option if possible. Different options could be, why don't you try going to the counseling center on campus tomorrow on your own? Or, why don't we pull out your health insurance and see what different types of mental health providers may be covered under your health insurance? Or, would you feel more comfortable if I called and set up an appointment with you? Or even if possible, would you feel more comfortable if I went to an appointment with you? The more options that are offered, the more likely that the individual may be open or willing to try therapy. After the action step is evaluation. You should evaluate yourself and how the referral process went with the individual. You should also ask them, how did this go? Are you comfortable? And lastly, follow up. Remain supportive. You don't need to actually prod in the progress, but you should record the referral recommendation and ask how the athlete's doing. Now we'll actually talk about specific levels of referral or exact situations in which a referral or psychosocial referral will be warranted. Level 1 is a prevention or enhancement referral. Again, as we previously discussed, this is the most uncommon type of referral or reason why someone may go to therapy, but it doesn't mean that it's not an important level or type of referral. It's very underutilized. In this level, the individual is not actively confronted with a psychosocial disturbance, but could benefit from working with a mental health professional. It's not necessarily causing a problem in their life, but if addressed, it may improve their wellness. So, for example, an individual who wants to improve their personal relationships or an athlete wanting to improve sportsmanship, relaxation and anxiety reducing skills. If an athlete or an individual or friend is feeling overwhelmed or way too stressed and is having a hard time balancing different aspects of their life. Someone could be referred for career and vocational guidance, as well as overall social skills and enhancement. Again, this type of referral is very much underutilized, but certainly could help benefit the wellness of an individual. A Level 2 referral refers to mental health distress. This is a situation where there's an emergence of a psychosocial issue in the life of an individual. This is the most common type of referral. Examples may include markedly different patterns in behavior and or mood, heightened anxiety, decreased personal hygiene, or use or abuse of alcohol or mood-altering substances, in addition to many, many other issues or distress that may warrant a Level 2 referral. This type of referral is potentially life-altering, and it's also extremely sensitive. Commitment must be enacted, and it's important to emphasize to the individual how much this type of referral can help them in the situation they're dealing with and be potentially life-altering. Lastly, a Level 3 referral is an emergency referral. This is categorized by an emergency situation in which the individual is confronted by immediate and volatile issues that are potentially harmful to themselves or to others. So examples would include aggressive behavior, loss of contact with reality, having suicidal or homicidal ideation or plans, the inability to communicate, or even hearing voices in their head. These are emergency referrals in which the individual should be referred to the emergency room immediately. If you cannot directly refer the individual to a mental health care provider, you should contact law enforcement for a direct referral to the hospital. And very often, especially on university campuses, law enforcement will have an on-call mental health provider. Usually, however, if an individual is experiencing the examples above, especially when talking about suicidal or homicidal ideations, the individual should be referred to the hospital for an emergency. Do's and don'ts of referrals. Do listen to the story of the individual and be supportive. Don't ignore the problem, even if you know that it's going to be confrontational or possibly uncomfortable situation. Do protect yourself, others, and the patient. Don't judge, preach, or pressure, or give your input on a situation. You should listen. Express concern for the well-being of the individual, but don't become the only support system for that person. You should collaborate and brainstorm, but don't probe about therapy after they're referred. Do assist in the communication process with the professional, and don't breach confidentiality. Do continue to support, but don't consider the process over or out of your hair after the referral occurs. Now you can move on to the next video.